Recently, we did another video in regards to name badges in your office and your personnel that delivers patient care tasks in your office wearing name badges. And there are a couple of challenges that come with this every once in a while, and so we wanted to help you jump some of those hurdles. The first is licensed massage therapists or other licensed personnel in your office, when you delegate tasks that may be tasks that are outside of their scope of practice but inside of yours as the chiropractic physician, that can create some challenges with their particular license. We have some great articles in delegating to licensed massage therapists and then how you can refer to them in your office as an LMT or a licensed massage therapist. Please review that material. It's online. Just go to ilchiro.org and do a quick search for delegation LMT, and many articles will pop up to kind of help you navigate what that looks like. But that also impacts name badges. The biggest one that we're hearing lately is some challenges that our doctors are facing in regards to social media. And some of the calls that we're taking is we're finding that some patients are seeing the names on the name badges of their personnel and attempting to friend them on Facebook. And of course, that creates some social media challenges for some things that we've actually covered in other videos, and that we have an online education in regards to handling social media in your office from a legal standpoint, and making sure that you're not in violation of HIPAA and creating potential problems in that regard. So take a look at all of that information we have online. But how can you handle this social media problem potentially with patients trying to friend and creating awkward situations for your staff? Well, this is easier. If the license doesn't require that they have their full name, we've given you the example that, for example, we believe that chiropractic physicians should have their full name, but you could meet the requirements of the two laws that we talked about, which, if you remember, are the Medical Patient Rights Act and the Truth in Healthcare Professional Services Act. To meet those requirements, we have a bit of a lighthouse, if you will, inside the Medical Patients Rights Act, and what it does is it says that you have to list the first name. So we believe that if you're delegating patient care tasks, especially to your unlicensed personnel, you could simply put their first name. And that should get you covered. Now, as far as your other licensees in the office, obviously if they're physicians, include the full name. There's a professional side there that it creates less awkward when the physician just doesn't accept any friend requests like we highly recommend on their personal social media accounts. But for your other personnel, it definitely can create some challenges. And so if you don't include their last name, that still meets the requirement under the law, and still fulfills that as long as you're including, chiropractic physician or their license if it doesn't require their last name and their full name on their name badge. So hopefully this information helps you out and helps you jump some of those social media hurdles in your office in regards to the name badges, and we'll catch you next week.